Hello and welcome students to the nursing process for the care of the immobilized patient. My name is Johnny Cortez and I will be presenting this lecture in conjunction with your adult musculoskeletal presentation. First of all, let's look at what an immobilized patient is. Again, an immobilized patient, when we're looking at the musculoskeletal system, could be a patient that is in traction, a patient that has had a recent fracture or is healing from a fracture, that is confined to medical bed rest. They may also be confined to a wheelchair or have requirements such as the pictured patient needing crutches, walker, cane, or any assistive device from that standpoint to aid in mobility. So there are 5 distinct areas that can be impacted with immobilization, and we're going to look at the 5 major ones. There are others, but these are the 5 that we want to focus on. And again, they're in conjunction with your nursing text, ACLI, that reviews the nursing diagnosis. So we want to focus on these 5 areas because these are some of the prime areas that ACLI has a lot of information for, especially with the immobilized patient. The focus areas, again, are going to be the respiratory system, the gastrointestinal system, the psychological or psychosocial impact, the impact on the integumentary system, or the impact on the musculoskeletal system itself. For example, you have patients that have suffered a stroke, and the stroke in and of itself is not musculoskeletal related outside of the fact that it led to immobilization. For example, the patient is no longer has the hand-eye coordination or the physical strength to be able to get up. Again, strength is a great portion of the musculoskeletal system. The other portion is the structure. Again, the muscles, tendons, and ligaments that move the bones are, again, where we're getting mobility and how mobility is formed. As we go through, we're going to look at the impacts of these 5 systems due to immobility. So, let's look at the impact on the respiratory system from the standpoint of immobility. So ACLI describes one of the primary nursing diagnoses as an ineffective breathing problem. Well, again, musculoskeletal in and of itself doesn't impact it, but due to the fact that your patient may be bedbound, there's certain precautions that need to be taken to maintain the strength for the lungs and also decrease the risk of aspiration, further complicating the immobilization of your patient. For example, as the diagram is pictured, you can see the various indicated positions of what is safe for your patient due to their immobility in maintaining their bed mobility. For example, you would never want to go in and feed your patient with them laying flat in the bed. Again, strong risk for aspiration, as well as it being comfortable for the patient. There are other body positions, whether it be semi-Fowlers or, again, we discussed the upright position, also known as high Fowlers. For those patients that have, again, ineffective breathing patterns, the risk for pneumonia is very high. Also, you take into consideration the patient that is suffering from a stroke that has the potential to be placed on a ventilator because they cannot maintain their own airway or meet the respiratory goals of their body. So we have to take specific precautions with those. And does anyone know what those precautions are called? Yes, they're called ventilator-acquired pneumonia prevention, also known as VAT prevention. And again, the goal of VAT prevention is to reduce the risk of the development of pneumonia within your patient population.